If your third eye is slowly closing, you may already carry the map of why and how to begin reopening it right under your skin. Before you scroll away, I want to show you a simple, body-based way to check whether your perception is dimming, and a gentle activation you can use tonight without priests, clinics, or anyone's permission. If you want the full activation sequence, subscribe now and stick with me through the checks. In the middle of the last century, a collection of texts surfaced in Upper Egypt that changed the way many seekers understand early spiritual currents. According to the Nag Hammadi library, and in particular the Gospel of Philip as one of those voices, certain traditions taught that some people carried subtle somatic signs, 3 small markers on the body, that pointed back to a primary origin. These texts do not speak in the language of modern science, they speak in the language of remembrance. They were treated uneasily by centralized authorities who preferred interpretation through intermediaries, and for that reason, these ideas were pushed to the margins. I say this not to claim historical certainty, but to frame a different possibility, that an experiential path existed, one that invited direct verification rather than mediated belief. To make sense of what follows, hold 3 images lightly and simply. First, the monada, call it the source, the primordial spark or center from which consciousness issues. Second, the demiurge, the craftsman who shaped the visible world, a shaping principle that can become a container. Third, the archontes, patterns or frequency intelligences that tend to obscure perception, creating a fog between you and the source. These names come from an esoteric vocabulary. Treat them as metaphors for dynamics you can feel: origin, enclosure, and obfuscation. When I say your third eye may be closing, I mean it metaphorically. I mean that the subtle faculty that senses beyond surface appearances, second sight, inner perception, is losing bandwidth. That dimming can happen slowly. Accumulated stress, cultural conditioning, unquestioned habits of mind, and, in the language of certain Gnostic traditions, the patterning pressure of the archontes. It doesn't mean permanent loss. It simply means there may be less clarity, less receptivity. The 3 marks the texts point to are not a magic key that forces open a locked door. They are somatic anchors that invite a remembering. The work is gentle, iterative, and intimate. We are going to perform 3 tactile checks now. Each one is simple: a soft touch, a moment of attention, an invitation to notice. No force, no diagnosis. If you feel nothing, that is entirely okay. Not feeling anything does not mean failure. It means practice, patience, and different timelines for different bodies. First mark, the origin anchor. Place both hands lightly at the place where your skull meets your neck, the base of the skull, the soft line where head meets spine. Don't press hard. Allow your fingertips to rest there, sensing the subtle shape where bone meets the flexible tissue. Some people notice a slight change in texture, a faint groove, or simply a sense of ease when they rest there. Others feel nothing at all. For a few who carry a somatic echo of origin, there may be a warmth or the impression of a tiny notch, a line, or a place that seems to respond differently than surrounding tissue. Stay with the contact for a full inhalation and slow exhalation. Direct your attention to the underside of the skull as if listening with your hands. Notice breath. Notice any shift of attention that feels like recognition rather than analysis. Second mark, the perception line, the one most closely tied to what this tradition calls the second sight, our third eye. Bring your attention to the outer edge of your non-dominant hand, where the little finger's base meets the wrist, the horizontal strip that runs alongside the hand. Use the fingers of your other hand to trace that area gently, moving from the little finger toward the wrist. You are not reading palmistry. You are learning to notice a subtle texture or a small horizontal line that sits apart from the usual palm creases. Some people report a slight raised ridge, a faint line, or simply a focused sensation, a kind of attentive hum when this place is stroked. This mark, in the mapping of these texts, corresponds to perception, your ability to see through appearances, to sense patterns beneath surface forms. When that faculty dims, this area may feel duller, less responsive, or quiet. When it is active, you may feel a little spark of clarity, an inner widening, or even a sense of yes that is not verbal but bodily. Third mark, the command heart. Place 2 fingers gently at the center of your sternum, just above the breastbone, where the chest feels like a meeting place. Press only lightly. For many, this area is a resonance center, a place that, when touched with mindful intention, can steady the breath and bring a calm authority. Tradition describes this as the point where declaration issues, the place that, when aligned, helps the person embody a clearer frequency of agency. People sometimes notice a soft warmth, an easing, or a quieting in the nervous system. Others feel no immediate change. Again, no shame, no urgency. These are cues for attention more than tests. After each check, pause inside your body. Notice whether your mind immediately offers explanations, doubts, or dismissals. Those immediate self-negating thoughts are extremely common. We expect them. They are part of the machinery that keeps a closed perception in place. Many seekers report that as soon as they feel anything subtle, a flurry of objections appears. I'm imagining this. This is meaningless. I'm too old. This is just my nervous system. According to the language of the tradition I'm drawing from, these intrusions can be understood as archontic interference, habitual patterns that habitually question and thereby dampen the experience. When those thoughts arise, do not engage them as facts. You do not need to argue. Here is a simple, non-confrontational technique. Name the thought as a thought. Silently say to yourself, thinking, or noise, or archontic, and then return to the place you were touching. Think of it as turning a nervous energy into a labeled cloud that you let drift away. The purpose is not to defeat the thought, but to stop feeding it with debate. The attention you bring back to the body is what recalibrates perception over time. If you notice resistance in the form of shame, I should have felt something already, treat that as another layer of conditioning. Offer the same, gentle naming, shame. Let it be a passing shape. You are not racing anyone. Many who have worked this way for years say the first honest shift is not vivid sensation, but a softer relationship to inner dismissal. That itself is progress. Now, if you want to try a brief activation, entirely optional, use this sequence. It is short, declarative, and designed to be a practical mnemonic that ties the 3 marks to 3 short statements. The phrase I offer is intentionally plain. I know my origin. I open perception. I command. It is 9 words spoken in simple present tense. You may prefer the word recognize instead of know, or another phrasing that feels truer to you. The words matter less than the embodied intention that accompanies them. Here is how to use the phrase. Place your hand at the base of the skull, touch lightly, and speak the first clause. I know my origin. Allow the words to be quiet and steady. No need to be loud. Move your hand to the lateral edge of your non-dominant hand, the perception line, and speak the second clause. I open perception. Finally, bring your fingers to the center of the sternum and speak the third clause. I command. Each phrase anchors to a place on your body, source, sight, and will. You can repeat the sequence 3 times if it feels right. This is not an incantation that promises an immediate, dramatic opening. Treat it as an embodied practice, a statement you make to remind the nervous system of a different ordering. Many people find that subtle sensations grow with repetition, sustained attention across nights, a softening of inner obstruction, a slow widening of quiet clarity. Others may never experience noticeable somatic feedback, and yet report incremental shifts in how they interpret reality. Both paths are valid. If the phrase feels too dogmatic, you may prefer a purely somatic alternative. Touch, breathe, and hold the intention silently. The practice is adaptable. Use whatever language does not create inner friction for you. If your inner critic seizes on the words, change them. Be aware of common objections and how they typically arrive. A scientific skeptic in you may say, "This is not measurable. That is fair." The practice is not a clinical test. It is an invitation to somatic noticing. Another objection: "This is superstition." If that voice appears, welcome it. Notice where it sits in your body. Sometimes the presence of skepticism is itself informative. It may tell you where cultural conditioning is densest. The technique I recommend in those moments is curiosity rather than battle. Ask, without judgment, "Where does this voice live in my body?" And then return attention to one of the marks for another breath. There are also practical safeguards to keep in mind. Do not press hard. Do not use the checks to replace medical advice. Do not perform them on someone else without informed consent. And do not treat immediate lack of feeling as spiritual inferiority. Patterns of sensitivity vary widely. For those who want a minimal nightly regimen, perform the 3-mark sequence before sleep for 3 consecutive nights. Keep it short. Touch the base of the skull and say the first clause. Touch the lateral hand and say the second. Touch the sternum and say the third. Do this once per night, or repeat up to 3 cycles if it feels supportive. Some people report that sleep deepens the integration of subtle practice. Some report nothing at all. Both are normal. What matters is the steady, non-coercive repetition. If, during or after these checks, you encounter an intense emotional reaction, old grief, sudden sorrow, or an unexpected memory, treat that as a movement of the nervous system releasing. Ground yourself. Breathe slowly. Place your hands over your belly, and if it helps, sit with someone you trust or reach out to a supportive friend. This work can occasionally unearth strong material. That is not a sign of spiritual failure, but a signal to practice with care. Let me return to the idea of the closing third eye. Imagine perception as a lens with a thin film gathering on it over years, tiny accumulations of fatigue, belief, social expectation, unresolved sorrow. The film does not signal final loss. It signals a need for cleaning. The 3 marks are not the only tool to clean that lens, but they are an accessible one. A direct, somatic test you can perform alone. If your perceptive bandwidth has narrowed, this is an invitation to small, steady care rather than dramatic promise. There are larger practices that extend this work: contemplative silence, sensory slowdowns, imaginative journaling, and community exchange with mutual respect. One of the most powerful stabilizers is simply naming a shared experience. If you want to anchor yourself in a quiet, dispersed community, post a single word in the comments. Type recognition if you felt anything at all, and type listen if you didn't but want to keep practicing. That single small act is both private and communal, a way to find gentle company without exposing detail. Before I close, a short optional invocation for those who prefer an addressed moment. This is not religious in a denominational sense. It is a practice of centering. If it sits well with you, speak it quietly to yourself with palms resting on the 3 marks in sequence. Source, I remember you. Sight, open. Will, hold my voice. Keep it brief. Keep it present. If invocation feels off for you, skip it. The practice is adaptive. There are questions I want to answer briefly because they come up often. Will this give me supernatural powers? No. Will it make you invulnerable? No. Will it make you suddenly able to predict other people's secrets? Almost certainly not. What it can do is help you cultivate a different relationship to feeling and attention, to reclaim a small portion of agency over how you perceive. For many people, that shift ripples outward into choices, discernment, and a quieter mind. Historically, knowledge that allowed personal verification, ways in which an individual could test and recognize their own interior, threatened the power of centralized intermediaries. That's one reason such teachings were marginalized. I mention this not to foment resentment, but to explain a dynamic. Direct experience is inherently democratizing. When a practice invites people to verify their own status, it reduces the need for gatekeepers. That historical observation is a backdrop, not a conspiracy theory. Use it to understand why some currents were less visible, not to indict particular people. If you feel skeptical, that skepticism can be a healthy filter. Use it to refine your attention rather than to shut down exploration. If you feel fragile, practice with gentleness and perhaps share the experience with someone steady. If you feel a small opening, tend to it without evangelizing. The practice is always more effective within honest privacy and disciplined curiosity than in spectacle. To close, you now have a simple, verifiable sequence to check the state of your perception. A somatic way to see whether that inner lens is dimming, and a concise activation to begin inviting it to clear. The third eye metaphor here maps primarily onto the lateral hand mark of perception, and the three marks together form a coherent pathway of origin, sight, and voice. The work is not one-off. It is a gentle tending. If you felt anything at all, type recognition in the comments. If you didn't but intend to continue, type listen. Either way, if you want to follow the activation series, subscribe and be here for the next practice where we will explore breath patterns that support sustained clarity. Remember this: awareness that your third eye may be slowly closing is not a verdict. It is an invitation. The path back into clearer perception is practical, somatic, patient, and communal. Take one small practice tonight and allow time to do the rest.